Hello and welcome to Wellness Wednesday Live. I'm Bethany Zell, Program Director for Healthy You at Cary Medical Center. And I am joined today by Becca Boulos, who is the Executive Director of the Maine Pubic Health Association. Welcome, Becca. Thanks for being
Thank
here.
you. So happy to be here. Thanks for having me.
Wonderful. All right. Thank you for taking time out of your busy schedule. Our whole month of April for the Healthy You program is focused on the topic of public health. And so we figured we'd go right to the top in the expert chain to get the big lowdown on public health and kind of educate people about what it is, because I think there's a lot of confusion out there in the world. So maybe you can just start by telling us a little bit about what public health is and why it's important that people pay attention to public health initiatives that might be going on in their area.
Yeah, sure. Happy to answer that question. And thanks again for having me. I'm excited to be here with you today. So public health is a big field, it's very broad. And what people in this field do is they focus on promoting and protecting the health of people and communities where they spend their time. And so I think one of the biggest or one of the most helpful ways maybe to think about the distinction between public health and healthcare, which it's often confused with, is that whereas a doctor might treat someone who is sick, people in public health try to prevent them from getting sick or injured in the first place. And then if they do get sick, we try to figure out ways to make sure they have what they need to get better. So making sure that they have health insurance, that they have health care, that they have food, they have transportation, they have the supports they need to heal. And then the other thing that people in public health do is try to promote wellness. So by encouraging healthy behaviors, eating well, exercising, seatbelts, things like that. So like I said, it is a pretty broad field. There's very few areas of society that don't have some connection to public health, but I would say that overall, our goal as public health professionals really is for just to help people be as healthy as they can and to make sure that they have a high quality of life.
So prevention to promotion to connecting people to resources and pretty much everything in between.
In between.
You're right. It is a pretty broad topic. And so I know, when you talk about celebrating public health, it's hard to identify that one specific topic that you're going to talk about. But I know you guys did just recently have a celebration. Last week was National Public Health Week. And so were there some specific topics that were focused on, or was it just kind of a big, broad, everyone pay attention to everything?
Yeah, great question. So every year there is 1 week dedicated to celebrating public health. And that means, uplifting the work that we do, trying to hone in on different topics within this really big field. And so each day of the week had a different theme last week. And that ranged from a focus on community, on resilience, on mental health, on rebuilding after the pandemic, on health equity, climate change, all sorts of different topics. And for each day, we would send out communications about that particular topic, talk about what we were doing as an association, also what were some other efforts that were going on in the state. So it was a really busy week because there was a lot, each day there was a lot happening. But a few of the things we did that I'll just share with you now is that last Friday we had a webinar with some of our other partners that work in mental health and just talked about the impacts of COVID on mental health in the New Mainer community. We also had 2 meetings with Senator King's staff and Senator Collins' staff where different members from MPHA met with them to talk about a variety of public health topics, including telehealth, tobacco use, substance use, and just broader public health funding, and just explaining what's going on in Maine, why are these issues of concern, and what are some things that could maybe happen at the federal level to help us respond to these different challenges. And then the last thing we did that I think should really be a daily reminder for all of us as we spend so much time on the computer was we had a nature challenge to try to encourage people just to get outside and, off their screens and enjoy this really nice spring weather. So it was a busy week, but it was a really great way, I think, to feature some of the important work that's going on here and just talk about some of these different challenges that that Maine and then other states across the country are facing.
Yeah, and I know that your work has probably had to evolve quite significantly with the pandemic. And, from the role that you play in the pandemic and helping communicate those public health messages to, being impacted, how has COVID kind of changed the public health world?
Yeah, there's really no area I think that hasn't been impacted. No area of public health, or really, I mean, any part of society that hasn't been impacted by the pandemic. I mean, this situation we're in is one that happens once every 100 years, and whether you work in public health in Maine or anywhere really around the world, there's been dramatic shifts. I think in a positive way, we've seen cross country collaboration in a way that we haven't seen in a really long time. Just open source, access to research articles, and I think that's significantly what contributed to the vaccine development so quickly, was just that sharing of information across research labs. I do think that people, and I'll speak more specifically about Maine because that's where our purview is, but I think that people are more aware of public health and its importance, and also just maybe a little bit better at practicing some of the tenets of disease prevention, like hand washing, like staying home when you're not well, things like that, that maybe before the pandemic we weren't quite as good at. I will say one thing that's been a little unfortunate, has been our field becoming more politicized, and that's caused some public health leaders to resign. And I think that's been, like I said, unfortunate. On the flip side, I do think we've been really lucky in Maine, to have the leadership of Director Shaw and Commissioner Lambrou and Governor Mills, just in terms of paying attention to the science and being transparent and communicating about it. I think that's been really helpful. And then the last thing I'll just say is I grew up in Maine, and I'm a really proud Mainer. And I think that one of the reasons I'm proud to be from Maine is our values in terms of wanting to help out our neighbors, and whatever they need, we want to do that to be supportive. And I think overall people have really done that. They've really stepped up to help the people in their communities with what they need. We've seen that with these pop-up kind of, I say they pop up, but and they sort of did, but there are these coalitions that have popped up around the state to help their municipalities with their communities with their COVID response. And we've been convening them since last summer just for some information sharing, resource sharing. And I just have found that to be so inspirational and really true to, I think, the ethic of Maine people wanting to help out the folks in their community. Some of the other things that have changed for us, in addition to fielding or facilitating those groups, has been fielding a lot of calls about public health. People have questions, and unlike a lot of states, Maine doesn't have local health departments all throughout the state. There's just two, one in Portland and one in Bangor, and we sometimes get confused for Maine CDC, which is understandable. So we've been fielding just a lot of calls with questions about where to get information, questions about testing, about quarantine, about the vaccines. So we've been busy in that way, just helping, trying to do our part to help as much as we can, and then certainly deferring other questions to Maine CDC when appropriate. So it's been busy, and I think that's true for all areas of public health. But like I said, it's just been really, I think, inspiring to see everyone really stepping up in whatever way they can to be supportive.
And I think you're right. I think there's downside obviously to the pandemic, but I think, some of those silver linings, like people recognizing public health and coming to you guys as leaders on that topic and as a trustworthy resource. I think it's awesome. And I think it's a testament to the work that you were doing pre-pandemic that people even thought to come to you and made that initiative and that connection. Really speaks to the work that you've been doing all along. So, we really do value your role in helping the pandemic and helping to communicate to the people and reassure people. And of course, connecting people to those resources on the prevention, the promotion, and, all the different places in between. Are there any Oh, actually, what are some of the most, besides obviously COVID and the pandemic that we're in, are there any other really significant public health concerns going on right now in Maine that we're focused on? I know, everyone's so absorbed with this that we kind of put all the other things on the back burner. But meanwhile, these public health issues haven't gone away. And in fact, some of them, like the mental health piece that we talked about a little bit earlier, have significantly worsened through the pandemic. So what are some of those big issues still
Yeah,
affecting
it's a
people in
great
Maine?
question, and you hit on a really important point, I think, which is it's been hard to work on other areas of public health in trying to respond to the pandemic, because it's not like they're not separate. They're all everything's connected. One big system. And I think there are a few things. One is I think we've all been reminded, if we weren't already aware of the importance of investing in prevention in our public health department, which for Maine is the Maine CDC. I certainly think that the value of relationships, whether those are professional or personal, has become even more apparent. Maine CDC was understaffed at the beginning of the pandemic, and so some of their staff have had to pivot, but there are other areas, and so because of that, they've had to pivot to help with the pandemic, and so some of these other areas continue to be worked on, and that's where the value of relationships is. I think through some of the other partnerships that the state has with nonprofits and with health coalitions, and just people really going above and beyond, both state staff and also folks that work for non-governmental organizations, trying to address all these really important issues. And then so some of those issues, and you just mentioned, we've been talking about mental health, certainly isolation, loneliness, feeling disconnected because of the physical distancing during the pandemic. Not everybody has broadband, and it's not easy for everyone to hop on a Zoom call or connect with folks in that way, and so it is isolating. Certainly there are concerns for folks who have lost their job, and maybe lost their health insurance when they lost their job. And so then there's a whole trickle down effect from that. I do think that opening up the window to apply for the ACA, for the affordable for insurance, to open up the marketplace, has been helpful for a lot of folks. And so I hope people know that they still can do that if they don't have health insurance, that you can still go to the marketplace and get it. So that I think has been very helpful. And then certainly there's been increased substance use during the pandemic, and that's been concurrent with, it's been harder for people to access services, and that there's certainly been a change in that now as opposed to a year ago. But that's been hard. Some of the other challenges are really, I mean, these are all complex. Climate change, that was the theme for National Public Health Week last week, and it's certainly not just tied to the pandemic, but and there have been some indicators that contribute to climate change that have improved. Less cars on the road, so a little bit less air pollution, but then also increased takeout, so there's a little bit more trash, and so there's some pros and cons. And then certainly, I mean, racism has been declared a threat to public health by the US CDC director, and a public health crisis by the American Public Health Association. And I think some of the systems that we have that can perpetuate racism and other health disparities, like bank lending and zoning, healthcare, those are also areas where we can make changes that then can improve health. And I think one of our challenges is figuring out, how do we do that, and how do we do it in a way that is fair and sustainable, and doesn't create unintended consequences that end up harming people more than we that harm people when we didn't intend to. So I think responding to these, it's not only identifying these challenges, but figuring out how can we respond to them in a thoughtful and responsible way is equally a challenge. And then just the last one I want to just touch on, in terms of the pandemic and behaviors during that. We're, like I said, we're in a once in a 100-year event, and there's definitely a light at the end of the tunnel with the vaccine rollout. I know there's concerns, certainly understandable, about the pause on the J&J vaccine. But even with that, there's other, there's warmer weather, there's other reasons to be optimistic. There are new variants and they do seem to be more contagious. And so I think one of the other challenges we face is just making sure that people continue to mask when in public and maintain their physical distance. Like I said, stay home when they're sick, just because we're not out of the woods yet. We did lead, and we're still leading or co-leading a campaign called Keep Maine Open with US PIRG, where local business owners talked about why mask wearing is so important for their business. And I think sometimes people can forget that the good public health practice is good business practice. When businesses staff and their customers are well, they're able to stay open and still able to generate revenue and contribute to the economy. So when we practice these behaviors like masking, like distancing, and when we're not well, then we're able to help those businesses stay open, and it is supportive to them. So I think the only other concern, I guess I would just add, is just making sure that people know that it still is important to mask in public and keep practicing the guidance that is coming out of the CDC, just so we can keep moving forward in a really good direction.
Yeah, and that goes for people who are fully vaccinated as well. I mean,
That's right. Yeah.
they haven't lifted that. And I know a lot of people are getting comfortable and they're thinking, I'm good to go. And, we all just need to hang in there a little longer. And I know you had mentioned the tobacco prevention work that you were doing. And interestingly enough, I had a meeting with my state senator yesterday to talk about some of those tobacco prevention funding for the prevention and treatment program here in Maine, and also getting rid of flavored tobacco and nicotine products that are targeting our youth in Maine, and looking at a cigarette tax, getting it up there. Our taxes on tobacco products have been raised since 2005, which is
long time,
unthinkable. And so, that would certainly price out some of our youth. How pervasive is that problem still? I know we recently had the age increase to 21 for purchase, but are we still seeing a lot of youth usage in that?
We are. Yeah. That's a great question. I'm so happy to hear that you were meeting with your state senator about this issue. E-cigarette use in Maine is a significant problem, particularly among Maine youth. And one of the things I don't think people realize about it is that the tobacco industry puts out, there are more than 15,000 types of flavored tobacco products on the market. And they're flavored, they're all over the chart. It's hard to find, if you could think of what a flavoring could be, it exists. I was on a call last week and someone said she looked up to see if earwax was a flavor, and indeed it is.
But then it's like, who's buying them? Like
adults? Kids.
They're not for adults.
That's the only. I can't think of an adult that wants to have an
like cotton candy. Like, hello, no.
So they're for kids. It's terrible. Actually, more than 15,000 different flavors, ranging from yummy gummy to earwax. It's for kids. And one of there are a lot of problems with that. The first is that we know that kids use e-cigarettes because of the flavoring. It's about 70% of kids who say that. And we know that 4 out of 5 youth who start using tobacco used a flavored tobacco first. So it's a gateway. It's what gets kids starting to use it. Initially, and I think that the data from the Maine Integrated Youth Health Survey will show this, but initially you thought that it was just flavored water. They didn't even know it had nicotine in it. I think that's changed, but it is nicotine. It is addictive. It's a tobacco product, and the goal in promoting these products is to get kids hooked. And so the name of the campaign that we're a part of with several other partners is Flavors Hook Kids, because that's exactly what they do. I also don't know if people realize this, but just one jewel pod or one pen has as much nicotine as a pack of e-cigarette, a pack of cigarettes. So kids who are vaping are consuming quite a bit of nicotine, and the products are really insidious. They look like USB drives. So if a parent
Mhm.
were to quickly, look at their child's desk or in their backpack, they may not even notice
You
that
wouldn't even
their kid has an e-cigarette.
know.
So it's a real problem. We're seeing increased use across the state, certainly with differences by which part of the state we're in or you're looking at. And if you go to our website, we have county level fact sheets that we prepared with support from Maine Cancer Foundation. And so depending on which county you're in, if you're in Aristic or you're listening in from somewhere else, you can see what the statistics look like in your part of the state. And we just published those, I think, about maybe last month. So it's still
Mm.
they're new. Um, but yeah, it's a big problem.
It really is. And you're right. It's so pervasive and it's hard to detect on our kids, but those flavors, I mean, they mask the taste. Like the old fashioned cigarette is disgusting. Like no one does that. It is like, ooh, this is the best tasting thing in the world. And so these flavors are really just covering all of that and making it slick and colorful and targeting our kids. And we were talking with the Flavors Hook Kids Maine folks,
Yeah.
and
Yep.
they told us, it's over $40 million that the tobacco industry spends just in Maine targeting. And so our prevention programs and treatment programs need to be funded fully.
Mhm.
And that's super important. And I know that that's a lot of the work that you're doing, working on those prevention and treatment programs and helping to move those efforts forward. So thank you. Thank you for all you're doing.
Thank you. I mean, it's like everything. It's an all hands on deck effort. It's we get it done through partnerships, and I think you bring up a good point too about how the reason for the flavors is that they do mask the taste of the product, and that's true for menthol as well. And you can see it even with the way that the tobacco industry markets their products. I mean, they really do target kids, but they also target
Minorities.
other underserved communities. I mean, in the 90s, they ran an ad campaign, or they had a campaign called Project Scum, SCUM, which stood for
Mhm.
Subculture Urban Marketing. And I mean, if that doesn't tell you about their motives, I don't know, what else would. So it's tough.
Yes.
It's a big beast to try to turn around, but I think at the end of the day, I mean, it really is about preventing kids from using tobacco products and protecting their health.
For sure.
Yeah.
Well, anything else you want to add to the conversation? I thank you. These topics are so important. And, as much as we can do to help get what you're doing out there, we will. But if you have anything else you'd like to add,
Thank you. I just want to thank you very much again for having me on and for asking about these issues because they are so important. And I want to thank anyone who is joining us today for what you've been doing to contribute to public health. This has been a really difficult year, and it'll continue to be. And I think everything that we each do to care for ourselves and for the other people in our life. I mean, you're part of the solution, and that's just really important, and I hope that people understand that.
yeah, and
So
I
thank
think
you.
it is an important point to stress that we all play a role in public health. So when we hear these messages, we need to be sharing them, we need to be abiding by them and helping to pay those messages forward. So thank
Yeah.
you again for the tools and the resources that you help provide that help us do that. And for those of you tuning in, we will see you back here in 2 weeks. We'll be meeting with the program manager for 211 Maine to learn more about some awesome resources and connecting with the public health information that you might need. And so we'll see you back here in 2 weeks. Thanks again.